Hey everyone, welcome to the show today, my so-called fabulous. I'm Tiffany and welcome everyone. So, we talk a lot about aging on this show and making yourself better. If tweaks here and there and making a difference. And that's what we're doing here today. So I select these different guests that I'm so lucky that they say yes to come on the show. This man has been in my life and the practice has been in my life for I think it's over 2 years now. Fort Worth Plastic Surgery and Med Spa here in Fort Worth, Texas is incredible. Everything they do, everything they offer, their team, their staff, and this guy sitting next to me. Let me tell you about him. So, Dr. Tony Daniels, I met him a couple of years ago. I went in for a facelift consult. We're going to talk about this, but he's with Fort Worth Plastic Surgery and Med Spa right here in Fort Worth. And I personally worked with them hand in hand on many, many projects and had quite a few things done. We're going to talk treatments today, what works, what doesn't work, trends, surgery, when it's time, when it's not time. Everyone, welcome Dr. Daniels, my friend and my surgeon. Welcome.
Thank you.
How
Pleasure to
fun
be
is
here.
it? So fun to do that.
Yeah,
Say
it's
that.
awesome.
Okay, did you just have a baby? I know you didn't, but
Yeah, we had baby number 2 back in June, so
oh,
he's almost a year old.
oh my gosh,
Yep.
you're kidding me.
Nope.
It's crazy how time flies,
It,
right?
it's a blink of an eye.
I know.
And the other one's 4, so
Two under four.
yep.
Okay, all right, and it's going well.
It's going
Everybody's.
as great as it could be.
I know. I love hearing that. I love that. I don't know if I'd said that when I was back in
Probably
that time.
not. Yeah.
Okay, let's just get started. Why in the world did you choose the aesthetic world and plastic surgery as your career?
It's a pretty good question, and it's not really straightforward. So when I was in college, I had the privilege to go to Guatemala on a mission trip and see surgery and like get to scrub in and do surgery, which as a 21-year-old was pretty amazing and eye-opening. And we were doing things down there, general surgery like thyroid hernias, but plastic surgery as well. And one day we're doing cleft lips and burns and hand trauma. So it just opened my eyes to plastic surgery and how broad it was. And then in med school, just developed more and more. And then you saw the aesthetic side of things. So after med school, I did 6 years in an integrated residency program in New York. So that was everything, right? That's the full breadth of plastic surgery, reconstructive, microsurgery, craniofacial. And I spent an extra year following that doing an aesthetic society endorsed fellowship where we just did aesthetic surgery, which is what my practice is now. So it's been a great experience learning all these new things.
Wow, and you started in Guatemala. Is that where you met Dr. Anderson? I
Yeah.
mean, the king of Fort Worth Plastic?
Yep.
I mean, and so he is,
He's been a mentor for 20 years. And that's super important in this field too. You kind of can't just go figure it out on your own. You need someone with good experience showing you the way. So I've been really privileged to have that
and,
as part of my life.
and he still does these trips
Every year.
every year.
Every
Do
year.
you still go or you have time?
I didn't go this year with the new baby. It wasn't in
Mm-mm.
the cards,
No.
but I hope that we can go back
Yeah.
next year. Yeah.
Doing research for this podcast and research on different procedures and treatments that you've shared with me on the internet, I see board certification,
Yep.
board certified plastic surgeon, double board plastic. What does that mean?
So that is a very confusing issue for patients and the public in general, and it's super important. Maybe when I was in residency, one of my mentors there, Malcolm Roth, he was the president of the American Society of Plastic Surgeons, and they started this campaign called "Do Your Homework" to learn what board certified plastic surgeons are, right? Because as you said, people go on their website and see, oh, board certified cosmetic surgeon. That's not really a real thing. There's something called the ABMS, which is the American Board of Medical Specialties, and there's only 27 or so actual board certifications. So credentialing does matter, and you need to go to someone that's board certified in plastic surgery or board eligible. Board eligible a lot of times just means, hey, this person just finished training. They haven't gone through the board certification process yet. They're doing it, but that does take time. So when I was finishing my training, the year after my residency, while I was in my fellowship, we took the written exam, which is the first part of being board certified. And once you pass that, then you could take the oral exam. That involves being in practice for a year, collecting all your cases, submitting them to the board. You go out to Arizona. They pick 5 of your cases. They go over it and try to more or less see where you stumbled or where you didn't. And then there's other things as well where they have unknown cases where they show you. But it's a pretty rigorous process to get through it. And Yeah, I mean, not everybody's eligible for it, right? Like if a family practitioner wants to do it, they're never going to be a board certified plastic surgeon.
Really?
It's
Okay.
yeah, unless they go back to residency and do the whole training all over again. But there are weekend courses or symposiums where they can go and get certified in cosmetic surgery. So
Cosmetic.
you really need to do the homework and learn the difference. Absolutely.
I mean, I really did zero in on that. And I said, that word is coming up on some and then not so much, which
Yep.
would scare me because we're talking about a face here or a body part. So,
Yeah, you want somebody
yeah.
that has a lot of experience. And all of these aesthetic surgeries that we do, they're all derived from reconstructive procedures. So whether that was trauma or patients that had major cancer operations where we're having to rebuild something, that's where we get all of our experience.
Right.
Yeah.
So let's set the groundwork because I want to talk about treatments versus surgery. I just want to talk about this because when I was 58, I walked in your office
Hmm.
and I said, I think I'm ready. All
Yep.
my friends are doing it, even friends half my age are doing it. I'm ready for a facelift. And you said what to me?
I said, you're not ready. Lucky
Yay.
you. You're not
Yeah.
ready. Let's do something else, right?
Right. Yeah.
Yeah.
You gave me other options too. And
Yep.
those options were,
Well, we talked about Elicor. So that's a coring device to remove very small pieces of skin and stimulate a response in the skin that's left behind to make new collagen to try to tighten your skin. But you came in, you're healthy. You've been taking care of your skin for years. I mean, that's the first and foremost thing right there. So an ounce of prevention is worth a pound of cure in this situation. You're never too young to start good skincare.
oh gosh.
Staying out of the sun, wearing good sunscreen, starting with lasers, peels. These are all resurfacing things for your skin to maintain your collagen, taking supplements. I mean, genetics are undefeated. So some of us are working against that from day one, but our overall health is super important as well. If you're not healthy, all the surgery in the world isn't going to fix
Not at all.
skin or anything else that's going on.
Exactly. And we decided to do the Elicor. I did 2 rounds of Elicor, and it's all over my Instagram and all over his as well on the Fort Worth Plastic Surgery. But I got good results out of
Yeah,
that. I
you did.
really did. And I was asking you when we came in, should we do round 3, you
Yep.
know? And my question was, going into this, when do you know that treatments it's over and now it's trying to go into surgery?
I think reestablishing what your goals are, right? So if you're ever expecting one of these minimally invasive devices or techniques to give you a surgical result, it's not going to happen, right? We can't oversell and underdeliver on that. So having good expectations about what's realistic is first and foremost where to start. Your skin is still good, right? So like I know it's going to get a response. Some people's skin is not so good when it's thin, it's lost its elasticity, the texture. We're dealing with deep lines. These types of treatments aren't going to work.
Hmm.
So age matters, health matters, same type of thing. So
And
I think you could still get a benefit from another one, but again, what are we trying to accomplish with it?
so let me ask you this because you hear, TikTok, Instagram, everybody has an opinion and
Yep.
they're not board
Yeah,
certified.
but they're experts.
I love that. So, why, when is it time? I mean, and I don't know how to say this correctly because I do have friends that are in their 30s that have
Yep.
had a facelift.
Yeah.
And you're obviously honest with me because I'm like, hey, I'm ready. And you're like, you're not ready.
Yep.
When would you say that a person is ready? Let's just, me.
Well, so I mean, again, what is your concern nowadays? Is it the same thing it was 2 years ago?
Yes.
Is it something that's
Now,
worsened over that
it's
time?
these lines right
Your
here.
nasolabial folds?
Yeah,
Yep.
and you told me, and you asked me, you said you've done Sculptra, you've
Yep.
done collagen enhance, you everything to keep the collagen and radio frequency does that too, right?
Well, yeah, same thing. It's injuring the skin that's there to try to stimulate a collagen
Right.
response.
So,
Yeah, absolutely.
so I've done these things
Yep.
my entire adult life.
Yep.
So, and I think Dr. Daniels, it is, comparison's a thief of joy. Well,
Yeah.
she got it. Well, I must, and I'm 10 years older than her.
Exactly. Well, so, if we're starting to see more jowling in this area or in the neck, more laxity, and especially here in the middle, there's something called platysma band. So the muscle right under the skin there, you can Botox that and soften this up. But again, that's a temporary solution, right? So if you're looking for something to give you more long lasting results, then it's time.
It's time.
But you have to be invested in it and the recovery that goes along with it and the process and everything else, right? Because these are not, you come in for an Elicor, that takes what, an hour? Surgery is going to be somewhere between 4 to 5. You're going to get some degree of anesthesia. Some people do them awake. Some people do it with IV sedation. Some people do it under general. For me, it kind of depends on the person's health and what that patient wants too, right? Because you know if you're going to be able to lay there awake and have this done. It ain't for everybody, for
Mm-mm.
sure.
Mm-mm.
So more people still go to sleep than not, but you just kind of have to have your mind wrapped around that whole process.
Right.
You're going to have swelling afterwards. You're going to have bruising. If we're doing surgery now, there are going to be scars, right? We can't do scarless surgery. We try to put them in spaces where shadowing can hide them. There's natural curves, but no matter what we do, the moment you cut the skin, there's going to be a scar of some kind there.
So let me ask you this. You did my upper blood,
Yep.
and I was awake, and
Yep.
I heard the Bee Gees, and I heard him talking. I did hear him talking, and it did. I was like, no, no, no. But I know the risk. So if you did do the neck or face or whatever,
Yep.
you would see the scars wear on me. You never see my hair down.
So yeah, usually they're right along the natural crease here, following the ear. And some people go straight up into the hair. Some people go along the sideburn. Again, it depends on the patient and what we need to do. So there's not just one operation or one technique and that's it. But they continue behind the ear, down to the hairline here, and in the chin here to address this muscle that we talked about at the beginning. So there is visible scarring. Now, scars fade over time, and there's good things we can do for your scars, but you have to be willing to accept that.
And with my breath, the scars are, I
Yeah,
mean,
it's minimal,
if
right?
you're on YouTube, I have makeup on, but it is minimal. And
Yep.
is that because it's a different type of skin or thinner skin or?
A little bit. I mean, we try to put that in the natural eyelid crease, right? So it's somewhere we know is going to be kind of more conspicuous, but this is right on your face.
Yeah.
So
Your team, Allie, and you, we were talking about doing the upper left, which is, tell us what it is.
So that's probably one of the most common things we do in the office for people because they don't want to have anesthesia, so we can do it awake. It's removing that excess skin or the hooding that's there. It's removing some of the muscle underneath and fat as well. There's fat all around our eyeball. It's cushion, it's support. It's supposed to be there. But as we age, it starts to kind of herniate forward. And if it's giving you a fullness to it, we just remove some of the fat as well.
And you did that. And I honestly, I'm like, I don't need this. What am I doing? I honestly, and if you've seen on both our Instagram,
Yep.
the before and after that we did, and I did tell my daughter, and I told Allie, that's your marketing manager, I was like, did anyone want to tell me I look like crap? Did anyone want to say that? Because what a difference.
Well, it makes your eyes look open. And I mean, that in and of itself, if it's the right thing to do, it can take 10 years off your
Oh
face, you
my
know?
gosh. And lower.
Yeah.
Talk about lower. Am I there yet?
Lowers are a more complicated topic. So there are people that do that awake. I'm not really one of them just because I know if I was having this done, I would want to be asleep for it.
I love that.
But same thing. There's fat there that often has to be removed or redraped over what's called the orbital rim here to refill this cheek fat that we lose as we age. There's a ligament there that we release that kind of causes the tear trough, where you see this hollowing out here. We need to release that. We have to resuspend the lower eyelid so it doesn't pull down over time or give you an odd shape. That's called a canthopexy. So, and then there's skin removal, right? There's still excess skin. So a lot of times what I do now when we're doing lower lid blephs is we remove the skin right below the lash line, but we'll do a pretty deep or aggressive chemical peel to that skin as well. Because this skin's kind of crepey and you can only remove so much of it before you cause another problem like lower eyelid malposition. Nobody wants to have that happen, right? So resurfacing that skin, whether it be with a laser or a peel, gives you a nice result as well. So that's what we've been doing for the last couple of years.
Can you do two upper eyelid? I mean, over time. Like,
Oh
is
yeah,
is
I
there
see a lot of people that come in and they're like, "Yeah, I had my eyelids done 15 years ago, and they want to do it again." So
Okay.
yeah, absolutely. I mean, surgery's permanent in the sense that we're removing skin, but you continue to age, right? And time and gravity are undefeated. We can't stop that. We just hope to slow it down a little bit
Yes.
by being healthy, by doing good skincare, but it's still going to happen to the best of us. So yeah, absolutely, you can redo it.
Okay, so I mean, it's all over the internet, all over social media. We've been talking about this. We've been talking about facelifts,
Yep.
the ponytail, this. There's all these. Is that like a steak, like a tenderloin? It could be a fillet, or it could be. Yeah, there is that.
Yeah, I mean, there's so many different techniques, and some of it's a little, just how you want to market yourself if you're coming up with a new name for the same technique. regardless, I think some things are common between all of them. You're going to remove some degree of skin, right? There is excess skin that's there, just like there is with a tummy tuck, with a breast lift, whatever. So that's part of it. The other part of it is the deep plane or the smash, right? So that's where that's what's all over the internet is doing deep plane facelifts, right?
Deep plane face.
Yeah.
Okay.
So the smash is the covering over the muscles of the face that we use to smile and make facial expressions. And a lot of times you have to cut into that and release some of the ligaments and tighten it back up. And some people you can just tighten it or plicate it like we do in a tummy tuck because the muscles have spread over time. So again, it's not one, one size fits all. It's you got to do the right thing for the patient based off of what their appearance is and what their desired outcome is.
Do you think we're overdoing it right now?
There are definitely people that are.
That are.
There's same with filler and that type of thing, right? Like if filler is the only tool you have, you're gonna keep filling someone's face because you can't do a face or neck lift on them. So you're gonna fill them until they're just filled out to here, and you see that, right? And
Oh,
it's not particularly attractive either. But
no.
but if all you have is a hammer, the whole world's a nail.
Right.
Yeah.
That's a good one. So filler, I feel like I haven't had filler in several years.
Yep.
And is filler, is it not as on trend anymore, or is it people just getting filled and
No, I think it still is. It's
yeah.
it's common as it ever was. There's just so many different kinds, right? So most of them are hyaluronic acid derivatives. That's something your body makes naturally. And we put it there and it draws water in and it makes everything look more full, which is a sign of youthfulness. Some of them are like what you talked about earlier, Sculptra. That
Mhm.
stimulates your body to make more collagen. Some of them are permanent filler. They're calcium hydroxyapatite. You inject that, it's there forever. You got to be careful where you're doing that and who's doing it for sure.
Wow. Wow.
And I always tell people start with the lighter HA filler, see if you like the result, and then fat's always an option too, right?
Yeah.
Yeah.
Yeah, the fat transfers,
Mm-hmm.
Chris. But can you, if you have a fat transfer, can you, if you are working out, running, cardio, is
Yep.
that an option? Is that a,
It's
that's,
an option, but fat, I think we got in trouble thinking fat was like a permanent filler,
mm-hmm,
right? Fat is still fat
fat.
when you put it there. And based off your metabolism, it's going to have the same characteristics that it did before. So if we're injecting fat here in a place where fat naturally shrinks over time and starts to fall, and you're someone that's pretty thin and active, I mean, yeah, it might look good for a couple weeks or months, but it's probably going to disappear more
Disappear,
quickly.
disappear more
Yeah.
quickly. Mm-mm. So when you're talking about filler, can you get dissolve it? Is that a thing?
Absolutely. With
Okay.
the right ones. So the HA ones that I started off talking about, those are dissolvable, yes.
Okay, that's a
Yep.
process, right?
It is, but it's necessary and sometimes you have to dissolve it, right? Because there's people, maybe if they're less experienced or just really bad luck, where you inject filler you're not supposed to, like into a vessel or something where you can actually cause skin death. I mean, I've never seen it luckily, but
Mm-hmm.
it can happen. It's all over the literature. Actually, I did see it years ago. Someone brought me photos of that for a news article to talk
Mm-hmm.
about it. And they actually said, well, this lady had an infection from Botox. I said, that's not what she had. She had ischemia from filler. So if you recognize that early and inject the dissolving material, you can kind of get away from that.
You can
So,
get away from.
yep,
Oh wow. If you are overfilled, can you have a facelift?
sure.
Okay.
Yeah, you still can. Absolutely. Yep.
Just work around it, right?
Yeah, I mean, that's the thing now, doing facelifts that probably wasn't really seen 20 years ago is everyone's had all these energy treatments like RF frequency or I mean lasers have been around a long time. That's nothing new, but all these fillers and you'll see that when you're lifting up the skin or this mask, there's more scar tissue there, but I don't think it affects the outcome long term.
Right. So Botox, I've had this conversation with you and several of your staff members. Botox, I will get it and it will quickly go away. I
Yep.
mean, I'm just,
Yeah.
here I am.
Well, it's kind of like I mean, for lack of a better comparison, it's almost like a vaccine. Your body makes antibodies to it, right? Or anything else, and you just kind of grow resistant to it over time.
Okay.
Now, there are different forms of neurotoxins, and sometimes you just keep going up on the dosage of what you're using, but maybe you have to switch and try a different one, you know? I mean, insanity is doing the same thing over and over again, expecting different results. So if it ain't working,
It's not.
more isn't going to be better.
Right.
Yeah.
And it's just and I'm a baby. My gosh, I'm ready to be asleep during the breath. But yeah, it just doesn't. And I'm like, I just metabolize it. So,
Yep.
oh, I think Haley was telling me in your office that just doing microneedling can help too,
Absolutely.
right? Tell
100%.
us about this.
So microneedling is it can go into the skin surface and you can vary the depth of how deep these needles are going, but it's the same thing. It's an injury. So whereas like lasers are energy or thermal injury, this is more of a mechanical injury, right, to the skin. And the whole point again is to stimulate your fibroblasts or the cells that are left behind to make new collagen,
Got it.
which gives you a youthful appearance.
Which we want.
We do want it, but I think too, if we're not paying attention to everything, if you're aging and you're not healthy, like you should probably be on collagen supplements beforehand. You should be healthy and eating a good diet or taking peptides or whatever the case may be. Like I've just gone back and looked over results for the last couple of years, surgery wise, with everyone on GLPs losing weight. Their skin's not the same as it would have been without it. So I think putting people on collagen is going to enhance their result for sure.
Well, let's talk about the GOP ones because that is a whole nother podcast.
Oh yeah.
But I mean, how is that affecting your business?
Just way more skin removal surgery for sure, which is something I've always done a lot of. I did my fellowship in North Carolina with Joe Hunstead and Bill Cortezis and Dr. Bahardi as well. And Dr. Hunstead wrote a book literally called The Atlas of Abdominoplasty. So I love doing tummy tucks. I mean, we do a ton of them. But yeah, I mean, a lot of people come in now that probably wouldn't have come in before with excess or loose skin. And if you got enough there to pinch and remove, all the energy treatments in the world aren't going to remove that.
Mm-mm.
So do your surgery, get it removed, and go about your life. But yeah, I mean, but it's everywhere. It's not just your tummy, right? It's the arms, it's the thighs, it's the buttocks, right? The Ozempic butt, because everyone's lost all the volume out of their buttocks and they have loose sagging skin there. So we're doing buttock lifts and
Really?
oh yeah.
Oh my gosh.
I mean, I was already doing a lot of them, but it's a lot more
Oh
for
yeah.
sure.
Oh yeah. Talk about trending. Yeah.
Yep.
So can you do that in the arms too? Can you remove skin from the
You
arms?
can. You're gonna have a visible scar, but it's a trade-off. And I don't know that I've ever had anyone come back that say this wasn't worth doing for the scar. Scars do fade over time, right? I mean, just like you talked about, we can microneedle scars the same way we microneedle your face to make the skin appearance look better. We can laser them. They do fade. On the arms or thighs, they might take a lot longer to fade than they would, say, on your breast or your face, because these are not areas where you're lifting things and
Right.
moving them constantly, but they do fade over time.
Right. I'm gonna microneedle myself.
Yeah, exactly. I don't
I'm
know that you can do it too much, so that's all right.
really
Yeah.
okay.
Yep.
Because you heal. I heal so quickly. I
Yep.
do heal fast. I don't know if you
You're
remember.
healthy.
Yes. Oh, that's
This,
right.
this is
So
it.
Ellicor, I think I came in to see you and you were like, oh my gosh,
Well, yeah, because so the issue with Ellicor, at least at the beginning, was the redness, right? It wasn't really pain.
Mm-hmm.
It wasn't like you had these crusty, weeping areas like you do after a big aggressive CO2
Mm-hmm.
laser or that type of thing, but you're just red. And we tried to modify that with aggressive skincare before and after, putting people on hydroquinone, which is skin bleach, to calm that down. We can do IPL treatments afterwards. Sometimes just using topical steroids helps as well. But yeah, you in particular, your redness was gone within days,
I
not
mean,
weeks or months.
no,
Yeah.
no, and
So everyone needs to do what you're doing.
yeah,
That's
and
yeah,
let me
let's
tell
just
you
do
what,
that.
and I'm going to say this. I had 2 rounds of Ellicor, and I remember because remember I had a big birthday
Yep.
coming up, and I'm like, I've got to do it, and you're like, no, no. I love because he'll say no, but they put me on, like you were saying, the hydroquinone. We prepped my skin, and I have talked to several, well, on my platform, women that had the Ellicor done, and there was no prep
Yeah.
and it didn't work out for it. Some of them had the tracking marks on
Yeah.
it. They didn't prep
Yep.
before and after.
It makes a huge
How
difference.
is see, and that is amazing that you guys do that. I'm so impressed because you figured that out, or your
Yeah,
team
yeah, we
did.
did. I mean, they had their recommendations on what
Hmm.
they did, but we kind of took it to another degree because I don't want to. I mean, what good did I do anyone if we removed their skin and made it a little bit tighter if it's now got red track marks
Hmm.
everywhere?
Yeah,
I mean, you traded one thing for another and it wasn't necessarily better.
right.
So yeah, absolutely. I think you just got to be open and evaluate your results and change them accordingly over time.
People cannot believe I did this. I did Ellicor on a Thursday morning and went to TCU football game on Saturday. tons of sunscreen, big
Yes,
hat,
super
obviously,
important.
obviously. But and plus, I don't care. I'm transparent like that. But they were like, oh my gosh, the day you did it, it was obviously red.
Yeah, a
Yeah,
little bit.
yeah, just
Yeah.
a little
It's like,
bit.
what
But
did I do?
yeah, what? Yes, I
Yep,
have said that when I've gone home. But yes, I mean, the treatment of the prior was incredible. So thank you.
of course.
All right, so let's talk about injections and injectables, Botox, all of those, and the youth that are doing that
Yep.
now. What are your thoughts on that?
I actually think it's great. I mean, if you're a teenager,
Y-
that might be a little young, but
Yeah.
your 20s, 30s, absolutely. It goes back to what I said earlier. I mean, skincare at the end of the day, right? You're investing in yourself for the long term to maybe put off getting that facelift for another 5 or 10 years down the line.
Right.
Yeah, absolutely.
Do you think that my why it's not working so much for me anymore? I'm 61. Is it aging? Is it because metabolism and working out? All those things,
Yeah,
right?
I think so. I
Yeah.
mean, aging, if someone came in at your age that was totally Botox naive, they've never had it before, then they're probably going to get along, for years, they're going to keep getting results from it. I mean, how long have you been doing it?
Yeah, well, you're gonna, I mean, this, I think I've told you this, because I couldn't afford it,
Yeah.
I started at 50.
Okay. So a little over 10 years.
Very
Yeah.
later in life. I mean,
Well,
compared to,
yeah, to people now.
right. But let me tell you, I graduated TCU. I could not afford ramen noodles, but I went to Highland Park Village and bought Select C vitamin C and used vitamin C on my face. Again, couldn't
Yeah.
eat, but
Well, vitamin C is super important for your skin as
see,
well.
yes, yeah,
That's actually something I tell surgery patients. Vitamin C, zinc. I mean, these things are important for cross-linking of collagen, which is what informs the structural integrity. So, yeah, you did the right things early on
yeah.
with
I
what
mean,
you could. Yep.
yeah. I kept my weight down too, obviously.
Yeah. Well, that's super important. Not smoking and avoiding the sun is one thing, right? Like we're kind of made to be outdoors. We're in Texas. You're going to be in the sun, but you can still wear good quality sunscreens, wear hats, and just limit your overall sun exposure.
So, what would be one thing that is the most important thing that you would tell everyone listening today that you do for your skin?
For me,
Mm-hmm.
well, honestly, trying to be healthy. That's really it for me. I mean, I use skincare products. I think that matters, but just trying to be healthy, not drinking, not smoking, taking care. But like being healthy is skincare as well, right? Like wearing sunscreen every day when I'm going to be outside,
Mm-hmm.
going to our spa and getting treatments. I mean, that's all part of my health. So,
Right, right. So,
yeah,
and the sunscreen, there's so much information out there. Lack of everyone's an expert, like you said.
correct.
Sunscreen, I wear it every day,
Yep.
and but I do try to get some vitamin D. I walk the
Yeah,
dog,
it's
and
important for you. We
yeah.
were designed to be outside in the sun,
Mm-hmm.
but like using good quality sunscreen, right? Like not probably what you're going to pick up on the shelf at Walgreens. That's got 100 different things added into it that maybe someone
Chemicals.
knows what they're doing, but probably not.
Right.
Yeah.
And y'all have an amazing line of sunscreen there
Yep.
at your that's a lot of products. So products when someone comes to you and asks about products. I know we have our favorites, we definitely do.
Oh
But
yeah.
what if someone's on a budget and they just can't get those higher end products? Are there still good ones?
Oh, there are. I mean, you got to start with the basics, right? Like a good face wash. You need to be cleansing your skin, something that exfoliates it. Retinol. I think everyone could probably afford some level of retinol and use that. That gets your skin cells to turn over. That's actually something we put patients on before they get peels and that type of thing because it enhances your result. And it's something you can do at home every day as well. So
Right.
starts with the basics but the key is to make it consistent. You can't just do it for a month or so, start to see a result and think, I'm good now. But I mean, it's just got to be incorporated, be part of your everyday routine.
Because this didn't happen overnight.
No, and we're not going to fix it overnight,
No,
right?
mm-mm,
Yeah.
not at all, not at all. Okay, so peels, going back to that, peels, there's different levels because I've had some at your office
Yep.
that are just, I mean, I don't even peel.
Yeah.
But then some, is that getting into lasers once peels and then lasers? Is that the,
You're getting into the same outcome, right? So you have your epidermis, which is the outer layer of skin that we see. And then there's the dermis below it, which has two layers to it. And you can vary the depth where you're treating off the strength and type of peel, but it becomes a comfort issue for patients, right? Like, I mean, a CO2 laser, an ablative CO2 laser, that's pretty painful, and you're going to have downtime for 10 days to 2 weeks. So you got to be prepared for that afterwards. So since we have operating rooms in our office, we can give people anesthesia and do those deeper treatments,
Yeah.
which is, I mean, same thing with the facelift. A lot of times we'll do a peel on the skin that we're not lifting, because the surgery is great to remove the excess and loose skin, but it's not doing anything for the skin we're leaving behind, right? That's what everyone's going to see still. No one's going to see what we took out. They're going to see what's left behind.
Right.
So you still have to treat that skin. And there's certain areas that really aren't improved by face and neck lift, like around the mouth, those wrinkles. Some people get smoker's lines and they've never smoked a day in their life, but they drank out of straws their whole life, or genetics again. And the only way you're going to get rid of those deeper ones are a combination of things, resurfacing, whether that's laser, peels, filler, etc. I mean, you kind of got to take the whole approach to it.
I was supposed to do a Fraxel in your office during the winter. Well, guess who didn't do it? I'm a baby. I'm just a baby, and I mean, you have the best staff, but I've made a commitment that once, after
Yep.
football season,
Yeah.
I'm gonna do it here in a minute.
I've had the Fraxel done a couple times. It's tolerable. If I can do it, it's tolerable.
Really?
Yeah.
Are you a baby too?
Oh yeah, for
Oh,
sure. They put
jeez.
it on the baby settings for me and do it. And we put, we have topical numbing cream. We have Pronox, which is nitrous oxide, which by no means takes the pain away, but it helps distract you a little
Oh
bit,
yeah.
if nothing else, and makes it tolerable.
Mm-hmm.
And the treatment itself is pretty quick.
Mm-hmm.
It's just there's a burning sensation afterwards that lasts for about 30 minutes. But then after that,
You're great.
you're
You're
great after that.
fabulous.
And you got nice baby fresh skin and
That's
it looks
right.
so good.
I'm
So,
gonna do it, but I'm gonna come in before that too, for sure.
yep,
So, when I first met you, the Ellicor was
yep,
brand new.
it was.
What is happening in the industry, and what do you see changing? What modern technology, modern health, modern medicine is about to happen? Do you see anything on the forefront?
Peptides have really been a game changer, right? I mean, I'm sure you've had plenty of people
Oh, I'm
talking about
doing it.
peptides.
Yeah, I am.
Yeah, I mean, and that helps your skin. Again, that's not going to help for removing skin, but I think if you're on that prior to these treatments, your results only going to get enhanced.
Really?
Exosomes are probably another thing, right? That's not something that's really been cleared by the FDA yet, but plenty of people are using them because we got into this whole PRP, or platelet-rich plasma, for a while, where we're taking your blood, spinning it down, and then injecting it or laying it on top, which I think works to some degree. But again, if you're older and unhealthy and you're doing that, like, what good is that doing, right? Exosomes are just tons of growth factors. So I think that will probably be a game changer combined with these treatments. It's a matter of how are we going to get it into you.
Wow.
Yeah.
Yeah, I just did this 8 weeks ago. I went and had stem cells extracted from my hips,
Yep.
and then I had external stem cells mixed, put in different areas for pain, for joint pain
Yeah.
and things like that, and chronic pain just in joints and
Yep.
from doing way too many things incorrectly.
Well, yeah. I mean, get in line, right?
Yeah. And so we were just about to go to sleep, and the doctor goes, "Hey, if she's got any left, do you want them on your face?" And I went,
Yeah.
"Is that a thing?"
Yeah.
And they did.
Yep.
Microneedled them on
Yep.
my face.
Yep.
Yeah, I was a
Yeah.
happy camper.
Yeah.
So, but that's mine and from the umbilical cord. I did it. So you've heard of this.
Oh, yeah. I mean, you can buy them off a shelf too, and you can get them through an IV. I mean, there's all kinds of different treatments with this, but I think we're at the infancy of where this is going to go, right?
Isn't it amazing? Can you believe where we are?
Yep. And energy is still there. There's a role for that. We know what it can do. How much further that can go as well. Is it ever going to get to the point where it replaces surgery? I mean, I'm sure everyone would love that, right? That'd be
Right.
great.
Right. But still,
I don't think we're there yet,
No.
or even close to it.
no. Okay, let's go. Tell me what I need to do. If you're on YouTube, you can watch him. What do I need to do at this stage of my life? And I'll take it.
For what? What if you came to me and this was a consultation? You said, "What? I don't like this. What is it you don't like?"
Well, I've told you I don't like this, and I thought my chin was, I didn't have a good jawline, but I think I'm
You
okay.
do. Yeah, you
Okay.
don't have a lot of jowling, which I think is what everyone's concern is when they get a facelift. It's neck skin, right? So for a lot of people with a face and neck lift, you see more youthfulness in the outcome from the neck than anything else. In tightening up that platysma muscle, both in the middle to get rid of these bands and back this way and removing loose skin, I mean, that'd be a home run. Absolutely.
Okay,
Yep.
and it's around the mouth. I mean, that laser, will that
Yeah, we could laser it, but if you're going to go to sleep for surgery, then I would just peel it at the
peel
same
it?
time. Absolutely.
Right.
Yep.
Well,
And you could, if you're going to do that, then just do the whole thing. Lift here. You lift this volume in your cheeks that's fallen over the years because that's what happens. We lift it back up. We resuspend it, remove the skin. I mean, you would do great with that.
is that a full facelift or is it
It's a face. It's a mid to lower third of the face, and then a full neck lift as well.
in a full facelift? What would that
The
be?
brows
The
or
brows.
forehead reduction, that type of thing. There's so many different ways to do a brow lift. It just depends, and you can do that at the same time for people.
Right. I'm
Yep.
always wanting to do something, just
Yeah.
because what you asked what I want to change, I want to be 20 years looking younger. I want this brain. Well, I don't know about that, but yeah,
Yeah.
yeah, just always look younger. But
Yep.
skincare,
All of it. You got to
healthy.
start it before surgery. You got to continue it afterwards. And I always try to tell people like a well done face and neck lift probably should turn the clock back in how you look 10 to 12 years, right? Somewhere in that ballpark. Maybe a little bit of fat grafting at the same time, whatever. But you're going to continue to age at the age you are now, right? Like you don't get to go back to be 48 and start aging at 48 again. You get to age at 60. So just know that going into it and use it as an opportunity to continue to take good care of yourself.
Right.
Yeah,
I do that. That's
you
for
do.
sure. Okay, I have one question for you left. And if these listeners and followers and viewers and your clients, patients could take one thing away from what you've talked about in the last 36 minutes, what would that be?
I think at the beginning, what you hit on was seeing a board certified plastic surgeon. If these are your concerns, go to that, right? Go to those people with those credentials because at the end of the day, we are the ones that have had extensive training and experience with this. That's not to say that other people aren't doing a good job of it, but they're learning after the fact, right? I mean, this is kind of what's ingrained into our thought process of day one of our training after med school or even during med school. So there's just so much more experience that comes with that.
Does, and this may be controversial, just because a plastic surgeon is Instagram famous,
Hmm.
TikTok famous, does it mean they're the one for you?
Not necessarily.
Hmm.
I mean, it's medical tourism is a real thing, right? Where patients go to Mexico or out of the country to get things done. But it works this way too, where people advertise themselves well. I mean, obviously they're successful at something. It doesn't mean it's the greatest surgery in the world, but people are happy. So it doesn't mean it's the right surgeon for you. Absolutely.
Right.
And you have to develop kind of that relationship and rapport and know like, hey, I'm okay seeing this person for a while and they're going to get me through this, whatever it is.
Exactly.
There are so many places where a nurse does the consultation for, the patient calls up and they don't meet the surgeon until the day of surgery. And as a surgeon and as a patient, that blows my mind. I would never be comfortable with that. I guess for some people, they either don't know any better or that's just normal. But it would just make me very nervous about the whole procedure.
I am out on
Yeah.
that. I want to see that person
Yeah.
for
And same
sure.
thing, like if you go somewhere, if you go to Miami to have a certain procedure, but you live here,
Oh,
who's going to follow up with you?
yeah.
Have you established that beforehand? Because just calling someone and expecting them to take you into their office, it might be more difficult than you thought it was going to be.
And the
So,
travel. And
yeah,
I mean, there's a lot of things you can do virtually, but
not
God,
surgery, not recovery.
not at all.
Yep.
Well, I think you're fabulous. Your entire practice is, and I just respect you all so, so much.
Well, thank you very much.
And
So great to talk to you today.
yes, and
Appreciate it.
you coming here in the middle of a work day, I appreciate it so much.
It's great. Thank you so much.
Yeah, and I'll be in soon. And everyone, I say it every single Tuesday. Everyone remember, keep being fabulous.